A patient undergoing cancer treatment is often faced with a lot of different expenses. So DISCO, which is a shortened version of discussions of cost, is something that we've been working on as a way to prompt physicians and patients to have high-quality conversations about treatment costs earlier on in treatment. We're going to ask you to complete some simple questions about your situation. If a patient has certain characteristics or certain issues, that app can take that into consideration and then give them a tailored list of questions that they can ask their physician. Part of the reason why I built this in the first place is that I knew its paper-based prototypes worked well, and I thought that this could work even better. The preliminary evidence is suggesting that the intervention is working the way I want it to. After the patients go through the DISCO app, we're seeing their distress over cost decrease. We see their efficiency with managing cost increase and efficiency with speaking with their physicians increase. There is no way I would have gotten here as quickly or as efficiently had it not been for the work that I was doing with CrossComm. It was way more collaborative than I think I could have hoped for. It wasn't me just saying do A, B, and C, and it wasn't a company saying you need X, Y, and Z. There was a lot of back and forth. I think they appreciated that this was the first time I was building something like this, and even if I had this idea in mind, they were always willing to say, you know, it might be more efficient if you do this instead of that. They sought to clarify what was most important and then work from that, which I found to be really transparent. I was more confident in my decision making, and all of my questions and concerns were always answered. CrossComm did a fabulous job of keeping it very aesthetically pleasing and very simple, lots of white space. There was one couple, and the wife was diagnosed with breast cancer, and her husband was in the exam room. The husband looked at the wife and he said, "That little app is really helpful. I never would have thought to ask any of those questions." And like that little moment kind of, makes several years worth of work kind of worth it. It's really about making the interaction between patients and physicians as optimal as possible.